It's a few minutes after the hour, so I think it's time we get started. I know there might be a few more people who kind of come in, but that's okay. This will be recorded and people will miss a minute if they don't want to. Just wanted to welcome you all to our Doctors for America Advocacy Grand Rounds on gun violence prevention, grassroots advocacy, and public health. My name is Halak Barnia, and I serve as the Vice Chair of the Community Health and Prevention Committee with Doctors for America, which oversees the Gun Violence Prevention Subcommittee. By day and night, I'm an emergency medicine physician here in the Chicagoland area, and I've worked at level 1 trauma centers for almost 20 years, working with gun violence victims almost daily. I've also been personally affected by gun violence myself. In 7th grade, I lived through a school shooting. And most recently, leaving work one night as I left the building, I found myself running from bullets that were being shot towards me in our hospital in a drive-by shooting, and ran for my life, thinking that each bullet fired may be the one that ends my life. It was only very natural for me to become involved with gun violence prevention work, and I started by joining the largest grassroots organization out there, Moms Demand Action. As a physician, I found that at first I was doing a lot of local lectures, educating my community, but then more recently, I began to understand for myself where I can make more of a difference. Working at grassroots level alongside groups already doing the work proved to be a lot more efficacious, in my opinion, for myself. I was already a member of Moms Demand, but I also joined groups like People for a Safer Society and Illinois Alliance for Prevention of Gun Violence, and found out how to connect various community groups and find the best ways to work together, and how as physicians, we have a unique perspective and role in all of this. This panel tonight is comprised of advocates with very different backgrounds who will show you that despite all of our different experiences, we can find ways of connecting and working together. Everyone brings something unique to the table, but we all need each other's strengths to do this work. Before we get started, I wanted to take a minute to just invite you to officially join Doctors for America as a paid sustaining member. By doing that and selecting a membership level, you help support DFA's organizational sustainability and mission. For those in medicine, one of the great benefits is that all paid members receive CME credit for all 12 advocacy grand rounds through the year that you attend a DFA, A DFA team member right now is putting that link in our chat. So if you're interested, you can click on that and join. We'll also be making a recording of this session, and all materials will be available afterwards. You should get an email that basically has the recording links and also the resources that we provide. Don't forget, we want to hear your questions. So as this session goes on, please make sure that you drop your questions in the chat, and we'll monitor that throughout. And if we don't answer the questions during the first half of the presentation, then in the second half, when we actually have a chance to sit and talk to our panelists, you will have a chance to get your questions answered as well. Okay, back to our program. On behalf of DFA and myself, I'm thrilled to have all of you join us this evening. We'll be hearing from panelists who are involved in gun violence prevention work, who came from various backgrounds, some who've been doing this work for years, others who have just begun, all with the same mission of reducing gun violence in our communities. I would like to say that one of the parts of this work that's very special to me is that while doing this type of work, you get to meet people who are extremely special in this. And this panel is a reminder of that. I've been able to work with each individual on this panel personally, and I feel that everybody has a different role in this, and I'm excited for you guys to see that as well tonight. I'll be introducing each of our panelists briefly before they speak. I'm going to go ahead and share my screen so we can see their slides as well. Our first panelist today is Lisa Geller. Lisa Geller is the Director of State Affairs at the Johns Hopkins Center for Gun Violence Solutions, a center housed in the Johns Hopkins Bloomberg School of Public Health. Lisa's work focuses on research, advocacy, and implementation of evidence-based gun violence prevention policies, including extreme risk protection orders and domestic violence protective orders. Lisa is also a mayoral appointee on the District of Columbia's Domestic Violence Fatality Review Board. Lisa graduated Phi Beta Kappa from the University of Wisconsin-Madison, where she earned her bachelor's degree in political science. She earned a master's of public health in health policy and injury and violence prevention from the Johns Hopkins Bloomberg School of Public Health. Lisa? Take it away.
Thank you, Hala, and Keisha and everyone else from Doctors for America. Really excited about our panel tonight. I am just going to give a quick introduction to the public health approach to gun violence prevention, talk a little bit about the work that we do at the Center for Gun Violence Solutions, and then we'll have a great discussion at the end for Q&A. So we can go to the next slide, please. Okay, great. So I know I might be speaking to some physicians or others in the medical community, or perhaps people not in the medical community. The one big difference in our approach in public health to the medical model is that we are focused on affecting change at the population level. The slogan at Johns Hopkins is protecting health and saving lives millions at a time, which is different than the medical model of treating one patient at a time. And what I love about public health is it's all about prevention. And that's certainly what gun violence prevention is about as well. And so I like to start off talks like these by first acknowledging that gun violence is so complex. There is not one solution. There is not one policy alone that's going to impact gun violence significantly, because gun violence is homicides. And within that, there are so many forms of homicide. There's police shootings, domestic violence homicides, community violence, mass shootings, and even more than that. Gun violence is also suicide. The majority of gun deaths are gun suicides, though gun suicides are too often left out of this conversation on how to prevent gun violence. And then there's all the other aspects of gun violence, such as the unintentional shootings. And all of these different approaches require different policies and different programmatic solutions. So when we look at this public health approach, we have typically 4 steps. The first is to define and monitor the problem. The problem could be any aspect of gun violence we're trying to address. And like I said, they will all have different solutions. They will also all have different risk factors and protective factors. So what are the factors that make someone more likely to die by suicide? And what are the factors that make them less likely to die by suicide? Those are what we call risk and protective factors. The third approach on this public health approach is to develop and test prevention strategies. And that is a big part of what we do at Johns Hopkins and at the Center for Gun Violence Solutions. We conduct rigorous research and test the efficacy of certain policies. And we will not endorse, we will not support policies that don't have a substantial evidence backing, because we know that not all policies will have a significant impact on gun violence, but certain ones like firearm purchaser licensing, also called permit to purchase laws, will affect gun violence, will be associated with significant reductions in both homicides and suicides. And then the fourth part of this public health approach is to ensure that once these methods are adopted, once laws are passed, that they're implemented. The fourth part of this public health approach is also a large part of my job as our Director of State Affairs. I make sure that the work doesn't stop when the laws get passed. You actually have to make sure that they're implemented, people know about them, they know how to use them. Because if that fourth step does not happen, then it's not really, the first 3 steps were for nothing, essentially. So if we go quickly to the next slide, just want to show some of those evidence-based policies that our center prioritizes. There are more than 5, but these are just the 5 that we feature on our website now. Again, gun violence is so complex. In 2021, which is the most recent data we have from CDC, there were nearly 49,000 gun deaths in the US. That was not only the most gun deaths we've ever seen, it was the highest rate of gun violence since the early 90s. We know that there was a spike in violence in the 90s, and it did go down in the past 30 years, but unfortunately we are seeing an increase. And so all of these policies listed here are steps in the right direction to curbing this gun violence epidemic. Next slide, please. Okay, this is my final slide. I always want to touch on the intersection of domestic violence and gun violence because it's my focus, my research focus at Johns Hopkins. What people don't know, and actually the title of a blog I'm writing right now is, if you want to stop violent crime, you need to take domestic violence seriously. And I really do believe that, because when we look at individuals arrested for violent crimes, any violent crime, they are much more likely to have a history of domestic violence than any other risk factor, really. So my research and work that I do with others at Johns Hopkins look at the intersection of domestic violence and gun violence. I published a paper in 2021 that found that nearly 70% of mass shooters in the US either had a history of domestic violence or shot and killed a family or intimate partner. And that was looking at data from 2014 to 2019. So of course, mass shootings are really a small part, less than 1% of all gun violence in this country, but is something that usually galvanizes people and either gets people into the movement or gets laws passed, unfortunately. And when we do look at those high lethality, high profile cases, what we see time and time again is that there was a domestic violence history in that individual. So there are a number of other statistics on this slide. I won't read all of them to you. You will get a copy of our slides at the end, but I did just want to touch on this intersection that I think is very important and not discussed enough.
Thank you so much, Lisa. we're going to have a lot of questions to go through at the end, especially about the public health approach. And I'm going to move on to Sarah Koniznik right now, and we're going to talk about another aspect of gun violence that is very important to listen to. Sarah Koniznik holds a bachelorette from Northwestern University and a master's degree from the Middlebury Institute of International Studies at Monterey. She's a professional gun violence prevention and criminal justice reform advocate. She has served in recent years as the organizer of the Illinois Gun Violence Prevention Coalition, and then as director of community engagement for Newtown Action Alliance, a national gun violence prevention organization founded in the wake of the Sandy Hook tragedy. In November of 2022, Sarah was elected to the Lake County Board and represents District 18 in Lake County outside of the Chicago area. Sarah believes passionately in local government and in the power of grassroots activists to build a better America. Sarah, go ahead.
Thank you so much, Hala, and thank you for inviting me to be here today. I am delighted to have the chance to tell you about how we're getting things done in Lake County, Illinois. Lake County is located immediately north of Cook County, which is where the city of Chicago is located. And as I'm sure you're all aware, violence does not respect borders. So the fact that we have a lower raw number of gun deaths every year doesn't change the fact that we've been seeing them rise 30% a year, just like the rest of the country has in the wake of the pandemic. So that is why I'm so happy that 1 year ago, we were able to launch the Gun Violence Prevention Initiative in the Lake County State's Attorney's Office. And the reason the Lake County State's Attorney and I designed this program the way we did is because we understand that gun violence is not a political issue, it's a public health issue. And we also understand that in order to find solutions to public health issues, you have to recognize the intersectionality of the gun violence epidemic, and you have to have integrated solutions. So we took that concept of doing more than one thing at a time, of not trying to solve a complex problem by breaking it down into silos. We took that one step further and we said, we're not only going to break down the silos in Lake County, where people are addressing the issue of gun violence under different banners. So for example, we have domestic violence groups that do amazing work. We have incredible street outreach professionals, violence interruption professionals, but they're not working together, right? So we want to be the big convener, but we also want to take it one step further. And this is why we've put an Office of Violence Prevention in a prosecutor's office. Preventing violence in all the ways that Lisa mentioned: community violence interruption, firearm removal, restraining orders, safe storage. All of those solutions are great, but ultimately, or assault weapons bans, they're all great and we need to do them, but ultimately they're just putting a Band-Aid on the problem. We also need to address the underlying issues, that the root causes of gun violence. And they are primarily in our underserved communities. Lake County, Illinois has several underserved communities, and we are centering everything that we are doing on the everyday gun violence that occurs in those communities. And we're doing that by devising and implementing short-term and long-term strategies to reduce violence through: 1, aggressive evidence-based techniques that rely upon intense and sustained engagement with at-risk individuals. 2, we're implementing criminal justice reforms This is why it's so crucial that our office isn't a prosecutor's office. We are incredibly proud to be one of only 3 prosecutors' offices in the entire country who are integrating efforts to reduce everyday gun violence with efforts to increase deflection and diversion, that is alternatives to arrest and incarceration for nonviolent offenses. The third thing we're doing is we're building community and networks of wraparound services so that when our community violence interrupters can intervene and stop violence from happening, and they don't just walk away from the individual after they've helped that person avoid being engaged in violence. They also are connecting them to other service providers throughout the county who can help them build the kind of lives and futures that they want to live. So in other words, if we just hop to the bottom of the slide, the Gun Violence Prevention Initiative, real quick, thank you, is a community-based hybrid between government agencies, community-based organizations, and for-profit entities to make everyone in Lake County safer. Next slide, please. And this sort of spells it out in graphic form. I'm not going to go through this in detail. I invite you to take a really close look and just notice that all of the services that we are connecting, all of the different types of individuals and institutions and professionals throughout Lake County that we're connecting with this network we're building, they are all being trained in trauma-informed care. It doesn't matter who or where you are in this network. You need to recognize that the kinds of, we call it PTSD in modern parlance, that so many people who are at risk and in risk of committing violence or being a victim of gun violence, that has to be addressed as well. And the same is true for the people who provide all of these services in many cases. So if we can go to the next slide, I'll wrap up. So I've been a gun violence prevention advocate for 7 years, full time. I've worked at all 3 levels of government, and I've worked with survivor advocates all across the country. All right. And what it has taught me is that Highland Park, which is in Lake County, what happened there on July 4th is a direct result of our failure to address everyday gun violence in underserved communities and its root causes. That's why we're doing what we're doing in Lake County at the state's attorney's office. I'd like to show you very quickly as I wrap up how these types of violence are connected. Next slide, please. Many people think, especially if they live in communities of privilege, that gun violence is primarily the problem of people who live in a very different kind of community, in an underserved community. That's not true. It doesn't matter where you live. All types of gun violence are your problem. And the connector, unfortunately, is when gun violence is high in Black and brown communities, the firearms industry uses racist marketing strategies to promote its products. There's a reason that the most popular assault style rifle on the market is called the Urban Super Sniper. The gun industry, not gun owners, the gun industry uses fear and racism to sell guns everywhere. They literally want gun violence to be high because then their profits increase year over year over year. That means now, today, all of our communities are awash in guns. And if we want to address the problem, we must do it together by reinvesting in our underserved communities and addressing its primary root causes. Thank you.
Thank you, Sarah. I'm going to move on to Dr. Elliot Lieberman. Dr. Lieberman is an otolaryngologist, a neck surgeon, and currently practices at North Shore Ear, Nose, and Throat Associates in suburban Chicago. He's a husband, father, mass shooting survivor, and has become a strong advocate for gun violence prevention. Dr. Lieberman's role in advocacy evolved in the aftermath of his own trauma. With the organization March 4th, this past December, he and his wife, a pediatrician, recruited a coalition of over 60 physicians from 25 states to meet with over 40 Senate offices in Washington, D.C. to present an evidence-based viewpoint for reinstating the federal assault weapons ban. In addition to lobbying, Dr. Lieberman has participated in dozens of media interviews to speak as a physician and a gun violence survivor. Dr. Lieberman.
Good evening, and thank you to both Doctors for America as well as Hala for including me tonight. It really is a pleasure. What I would like to share with everyone tonight is, to me, a rather unexpected, but to a stranger, probably an unfortunately common journey into advocacy and going from 0 to 120 miles an hour in under 6 months. So as Hala said, I'm a husband, father, and surgeon in Highland Park, Illinois, and you can show the first picture. This past July, like my family has done annually, we attended our town's parade. And as you know, instead of celebrating freedom and independence, we found ourselves under attack. In the aftermath of her own trauma, my wife, who is also a physician, used her voice as a pediatrician to immediately engage in media and use her platform as a protector of children's health and safety. You can show the next set of pictures. In the background, I, as a surgeon, who doesn't typically treat victims of gun violence, stayed a bit more shy and found myself both supporting her and my children. Within 48 hours of the parade, Kitty Brantner, a mother of 3 in a nearby town, started a new organization, March 4th, with the intention of lobbying for the federal assault weapons ban, which had been a law from 1994 until its sunset in 2004. And although mass shootings represent just a small fraction of gun violence as a whole, as some of the other speakers have discussed, my wife and I became witness to the permeation of trauma that extends within thousands upon thousands of community members, and decided that we were going to take action against the rising incidence of mass shootings by targeting the weapon that creates the greatest number of injuries and fatalities during one of these events. The next week, my wife traveled to DC, met with Congress, the second gentleman, shown in the picture on the bottom right, and continued speaking to the media, as well as joining forces with the survivors of the Uvalde mass shooting. Upon her return, she was energized and began brainstorming how to move forward. And in the weeks that followed, for the first time since 1994, the House of Representatives passed the bill on the federal assault weapons ban and sent it over to the Senate. Please. As we approached September of 2022, we tried to figure out how we could use our skill set as physicians to amplify this message. We remained aligned with March 4th and established a medical subcommittee within the organization. It started as just 3 of us, me, my wife, and a former social worker. And we began creating an argument in favor of the assault weapon ban. You can show the next set of photos. And to my horror, as a physician who doesn't treat gunshot wounds or protect children beyond their ear, nose, and throat, I learned that firearm-related injury had become the leading cause of death in children as of 2020 for the first time in our nation's history. I also saw the numbers of the rising incidence of mass shootings, and from here, the journey really took flight. Much like a research project, the process became natural. First, we sought out to find the data, and then I began attending town hall meetings virtually to learn about historical and present attempts at legislative change, and I began reading and studying votes on gun violence and safety legislation that had occurred previously. We created an online petition, and for our next set of public health meetings in September, we set out to meet with the 4 physician senators, none of whom were currently supporting the federal assault weapons ban. You can show the next photo. Without a handbook or a guide to advocacy, I contacted these offices and created a schedule for us to have these physician-to-physician discussions, and we created our first physician team, shown here. We had 2 physician brothers, one in emergency medicine and the other in internal medicine, who attended our town's parade, a DC-based pediatric emergency physician, and a pediatric hospitalist on call at our local hospital on the day of the parade. You can show the next set of photos. And on this trip, March 4th brought survivors from over 10 mass shootings to speak on the lawn in front of Congress and lead a rally. We learned that the public health approach was amongst the most successful of all the meetings that we held on the Hill, because as the data tells, there's a very grim truth regarding gun violence. You can go on to the next slide. After the September trip, we soon realized what our message was missing and greatly needed: constituents. And for the next 3 months, we began amassing a coalition of physicians across the country. We plan to return again in December, but this time amplifying our public health message with physician constituents in Senate offices where support for the federal ban could be obtained. Meetings featured 2 to 3 physician constituents, coupled with 2 to 3 other physician gun safety experts from nearby states. Although the majority of our physicians were ER doctors, trauma surgeons, and pediatricians, we also welcomed a dermatologist, a radiologist, and some retired physicians. Over 60 physicians participated, and we met with 40 Senate offices. Here are photos of our groups from Iowa, Texas, Maine, Louisiana, Montana, and West Virginia. We also held a social event, next photo, with Brady, and held a press event in front of the Capitol featuring physician speakers, including Joe Saccharin from This Is Our Lane, and Senators Durbin and Blumenthal. And although as a result of our meetings, the Senate ultimately did not bring our bill to a vote, we were ultimately successful in creating a nationwide physician network, bridging relationships with congressional offices and gun violence prevention groups, and gaining 2 more co-sponsors for our bill. In this 6-month journey, there were several things that I learned. First, you can bring up the first point, Hala. Politicians need advocates more than I realized. In a democracy, the power really is with the people. And although social change takes a long time, it is the message of the people that really carries this momentum. And the only way that we're going to see change is when the politicians realize they have more to fear from us than the people who finance their campaigns. Public pressure and media presence really are critical. And I'm now very fortunate to have very successful working relationships with congressional offices to advance our mutual goals. Second, physicians really do have a role in gun violence advocacy. You don't have to be a survivor to get involved. Many of the physicians that were with us on this journey were not. When the leading cause of death in children is firearms, then physicians absolutely have a seat at the table. Physicians are the protectors in the line between life and death. And finally, you can bring up the last point, Hala. This work really is rewarding. Physicians are motivated by the scientific method, and there is very strong evidence in support of not just a federal assault weapons ban, but also universal background checks, red flag laws, and safe storage. Joining a coalition of like-minded professionals can be incredibly gratifying. In the weeks that followed our December trip, we received many meaningful messages from our physician constituents. Most notably, a mid-career urologist from Michigan told us that the experience was really the highlight of his career. And I think for many of us, practicing medicine has a strong and valuable place in our lives, but our work extends far beyond the patient room. You can join our physician coalition if you'd like by logging on to wemarchforth.org, and you can participate in some of our advocacy meetings, help recruit professionals, as well as volunteer in many of our projects. Thank you.
Thank you, Elliot. And last but not least, Lauren Harper. Lauren Harper joined Moms Demand Action in 2019 as a group lead. She grew the New Trier Township group to over 3,000 volunteers. And in 2022, she took on the state legislative lead role for Moms Demand Action in Illinois and led over 30,000 volunteers in Illinois through the advocacy process of passing the Protect Illinois Communities Act. She has a passion for solving root causes of gun violence within Illinois and believes grassroots advocacy is key to motivating lawmakers and achieving long-term solutions. Lauren.
Hi, everybody. Thank you so much for having me here tonight. It's so nice to be among such passionate people and knowledgeable people. Hala had asked me to give a little bit of context for how I got into the gun violence prevention space. I think because my story is actually very identifiable, and it shows that we all have an avenue into this fight, even if we're not a physician or an expert. I'm not a survivor, but like many of the people across America, about a decade ago, I started feeling pretty despondent about the constant barrage of news stories on mass shootings and school shootings and violence in cities. And at the time, I had 3 small children. And I realized that unconsciously, when I would drop my kids off at school, after they would get out of the car and close the door and go on their way, I would say under my breath, "Don't get shot," to myself. And I realized that this was such an unhealthy and unsustainable thing for me. And I thought to myself, I can't be the only person having this feeling. So anyway, I jumped into Moms Demand Action at the local level. And I dove in pretty deep. And I chose this organization in particular because it seemed to have a place for every level of commitment and every level of expertise. So for those of you who don't know what Moms Demand Action is, it's a grassroots organization of more than 10 million people across the country, fighting very simply for public safety measures, laws, common sense legislation to address the epidemic of gun violence that you heard about tonight. I'll give you one example of what we do at the local level. It's some of the most unglamorous work that happens at the local level, but I believe that it's some of the most important. Going back to what you've heard a few times tonight about things like safe gun storage. one thing that I find staggering is that 54% of people don't lock up their firearms properly. And 44% of people in America report living in homes with a gun. So if you think about more than half of them not being locked up properly in a country where we have 420 million guns, you can see why discussing safe gun storage in communities is so important. So we do a lot of work at the local level, educating schools and school boards and administrators and police departments and PTOs, not only about the scope of the problem, but also about why specifically locking up your guns is the first line of defense in keeping people safe from gun violence. We also do a lot of work at the state level, which is particularly exciting for me right now in the role that I'm in, because I get to help develop the legislative priorities and strategies for the state, and pick which laws we're going to push for and advocate for, and help our legislators have direction on this. And in Moms Demand Action in Illinois, as Hala said, we have over 30,000 volunteers right now. So watching that army marching forward in concert with all of these amazing community partners that we work with on a daily basis, like the League of Women Voters and Doctors for America and March 4th, and well, you name it. It's very gratifying work. At the federal level, what you see Moms Demand Action doing frequently is taking a template of success in one particular state and then trying to apply it to other states. So hopefully we will see some of the legislative successes that we've had in Illinois now be applied, for example, to Michigan, because they have a similar Democratic trifecta of Congress and their governor right now, which would perhaps allow some progress to happen in their state as well. So you can go to the next slide, Hala. This brings me to a very exciting legislative victory that we had recently in Illinois. The Protect Illinois Communities Act just passed about 6 weeks ago in Illinois, and it was a culmination of lots of different groups' efforts, not just Moms Demand Action, but certainly we were leading the charge. The bill, you can see here a bunch of moms up in the galley in the Senate, and our Governor Pritzker, signing it into law. And on the bottom right, you actually see, I think about 60 of the March 4th doctors actually testifying in some of the House hearings. So Hala, you can go to the next slide. In Illinois, this specific piece of legislation banned the sale and manufacturing of assault weapons and high capacity magazines and switches and clips. It also extends the duration of firearms restraining orders from 6 to 12 months. And these are laws that allow firearms to be taken away from people who are deemed to potentially be at risk of causing harm to themselves or others. It also helped or will help to address gun trafficking. In our state in particular, we know that a lot of the guns that are involved in crimes, over half of them, are actually coming from other states that have looser laws on guns. And then the other thing that it does, which is really important, and it's one of the first of its kind, is that the bill actually creates a registration and a serial number for all of the firearms that are grandfathered in. So you can go to the next slide. So this was just an exciting bill for so many reasons, partly because it addresses a lot of different things, but it also showed our lawmakers in Illinois, and I think across the country, the power right now in the gun violence prevention advocacy movement. There are lawmakers now that have really rethought the calculus on common sense gun legislation. They now realize that it's a winning issue, it's a winning ticket. And we now have lawmakers reaching out to us. I had 3 this week reach out to ask for meetings to see what our priorities are for this next session and ask what bills we want to see, which is exciting. So what we really want to see moving forward in Illinois and across the country is much more comprehensive gun policies coming forward. We want to address more than just assault weapons. And going back to what I said before, safe gun storage is at the top of my list. It's the first line of defense. I would love to see bills that allow for the gun industry to be sued for all sorts of things: deceptive marketing, marketing to children, liability, not improving their product safety, things like that. And then going back to what we heard before from Sarah, we would love to see renewed funding for community violence interruption programs. It's critical to addressing all of the root causes of gun violence across the country and across our state specifically. And as well, what Lisa had mentioned before with regard to domestic violence, we would like to see some stronger legislation be implemented to address some loopholes that we have here in Illinois, but that's something that we should be seeing across the country as well. So yeah, that's what we're hoping to see in this next legislative session. And I'm feeling very optimistic about it.
Thank you so much, Lauren. I'm going to stop sharing my screen right now, and then what we are going to do, first of all, it's so great to hear from all of you guys. Each of you has such a great perspective and a different voice, and coming from a different arena in this. I've had the pleasure of working with each and every one of you separately. And for me, it just shows you how much work there is out there and how many people are needed, and how you can start at any level in this arena, whether you are researching or whether you are advocating with your voice out there, or whether you are standing with a sign in your hand. There's always something for somebody to do. And the most important thing is to just take that first step forward. For me, I feel like you easily can overextend yourself in this work too. I'm sure my husband would clearly agree with that, and probably friends and family. But I feel like it's, as you mentioned, I think maybe Elliot, you had said this too, it's very empowering. And not just that, you do feel like at times you're making a difference, even though so many other times you feel like you're not. So I think the world of advocates is such a strong one, and joining it also gives you this very great group of people that you get to connect with, and like-minded individuals. And I feel that that's a huge plus for me as well. So thank you everybody for your perspectives. Very, very great to hear. I think what I'm going to do first is just go ahead and ask you each a question. And then after that, I know that there's many audience or members who are asking, attendees who are asking some questions as well. And, but I'm going to start with just asking each of you a question kind of related to what you talked about, and see what your perspectives are. I'll start with you, Lisa, if that's okay. How do you feel that entities like Johns Hopkins and researchers in general working in conjunction with grassroots organizations kind of work together? And how do you think that they benefit from each other?
Yeah, that's a great question. I will start with how we benefit from grassroots organizations, because Johns Hopkins is a research entity. We can't be everywhere all at once. And so it's really the advocates on the ground, like a lot of people on this call, who make the change, because you can be invested in your state legislature, in your city, on the ground, knowing the day-to-day issues, having your elected officials' ears. So that is critical. I mean, it's critical everywhere. It's critical to our work at Hopkins. And we try to, our approach to state-based advocacy is to empower those on the ground. And if that means that I help someone, provide them with the latest CDC data on what gun violence looks like in their state, that's what I'll do. If it means that someone reaches out to me, whether it's an advocate or a lawmaker, and says, give me all the research behind extremist protection orders, then that's how I will help the groups. Our model, again, is not to, come in and tell people how to do things. It's to provide them with the research that our center puts out, help, be the best advocates that they can be.
Thank you so much, Lisa. Sarah, to you, I'd like to ask, how can we work to address the root causes of gun violence in addition to advocating for policy change? Is it possible to be doing both together, and should we be doing both together more?
Not only is it possible to both address the root causes of gun violence and make policy change, I would argue that they are one and the same. And the reason for that is because nobody, or very few people in America anyway, are used to thinking of the gun violence crisis, or are used to thinking of addressing root causes as gun violence prevention. But I really believe that physicians and everyone listening today, that's not going to be a big cognitive leap for any of you to make, because there's no one who understands complex systems better than medically trained professionals. So much like the human body, societies are very complex. And when one thing happens in one community, has an effect on the neighboring community. So I described our local gun office of violence prevention in our state's attorney's office here in Lake County. And getting that office in place took 6 years of policy work, policy advocacy. A lot of things had to change before this office could come into being, starting with we needed a state's attorney who was in favor of this type of model. So I have been a longtime gun violence prevention advocate in my local area, and I pulled a bunch of people together, and for 6 years, we just didn't stop fighting until we got a state's attorney elected who was reform-minded and who was interested in not just trying to make people safer, but trying to address the underlying reasons that so many people feel unsafe in Lake County. You know, a lot of things, a lot of policy change has to happen in order for us to meaningfully do both things at once. Address the acute problem of everyday gun violence, while at the same time creating changes in our criminal justice system to create alternatives to arrest and incarceration for nonviolent offenses. A lot of policies have to change at all levels of government, in our local health department, in our judicial system, in the way the law enforcement agencies work together and within their own staffs, and the kinds of practices that they consider acceptable and those that they do not. So not only is it possible to do both, you kind of have to do them in tandem. So again, I'll just echo what Hala said a few moments ago. It doesn't matter who you are, you have a role to play. I say all the time, doctors have great social capital just because you're doctors, right? So even if all you have time to do is to talk to your friends and neighbors and help spread the word, help them see, right, that gun violence is complex. And if we're going to solve it, we need a complex set of solutions, in the same way that you often need a complex set of solutions in order to help make someone healthy. The same is true for communities and states and nations.
Yeah, I fully agree with that, Sarah. Thank you so much for that answer. Elliot, I have a question for you. When we met before the panel, you had mentioned that as a physician in your field, you've not spent a lot of time taking care of gun violence victims. What do you think makes physicians qualified to take on an active role like you have? And what do you think is preventing more doctors from doing it? And how would you encourage physicians and healthcare professionals to kind of get more involved?
I think that's a great question. It's one that actually came up in the lead up to our December fly-in. We were recruiting many physicians, some of whom, like I said, were not ER physicians or trauma surgeons or even pediatricians. And they had many questions. And I said, you are a scientist, you are a researcher. Look at the talking points. And if you give a physician a list of data, a summary of data, they can memorize that very easily and find a very accurate way to present it. Unfortunately, many of the gun safety researchers are unable to lobby due to conflicts of interest with their funding. So we have to speak on their behalf. So we have to interpret their data and present it. And there's no one better, more apt to present that data than a physician. And I'll be brief here because there's a lot of really great questions in the Q&A.
There really are, and we'll definitely get to them. Lauren, one last question for you before we move into the participants' questions or the attendees' questions. For you, in your role now as Illinois State Legislative Lead for Moms Demand, you see a lot of different advocacy groups working to get various GVP bills passed. How have you seen the role of healthcare workers add to this work? And do you also have any suggestions for folks in general, whomever they are, who want to get more involved?
Yeah, that's a great question. Right. So like everyone brings something very unique to the conversation when they're talking to lawmakers. We all have our expertise. You could be a child and you have an expertise because you go through lockdown drills and you maybe go to school afraid, right? But physicians have, I think, a unique perspective in two different ways. One, when they talk to lawmakers, they're just so credible, right? So you can talk to lawmakers about the lifelong physical and emotional toll that gun violence takes on victims and their families. You can talk about the physical impacts of a bullet on a human body. And that is something that's unthinkable for our lawmakers to have to contemplate. But when it comes from doctors and experts that have, dozens more years of schooling, it does really make an important impression on them. But the other side of it that I almost think is even more important for physicians is talking to their patients every day. You're already in the room talking with people who trust you at such a high level because of who you are and what you represent in their life, but you're also asking difficult personal questions already. And I think asking patients things like, do you feel safe in your home? Are there firearms in your home? Or if there are firearms in your home, are they stored safely? And then I think also just empowering them with information and saying, if you have firearms, do you feel like you're emotionally equipped to handle the fact that that's a burden that we statistically know means that if you're a man, you're maybe 12 times more likely to die of suicide. If you're a woman, you're 35 more times more likely to die of suicide. So these are hard conversations, but if we start to normalize them in a safe space with experts, I think it's the first line of defense to keeping firearms out of the hands of people that could do harm to themselves or others. And then to answer the second part of your question really quickly, I would say in general for everybody, read the Johns Hopkins report in full, educate yourself. I would say read the CDC report that just came out recently on the mental unwellness of teens. I think the realities of gun violence will make a lot of sense if you read both of those reports, and just join GVP group. If it's Giffords, if it's March 4th, if it's Moms Demand Action, if anybody, just join a group and get involved, because we just need louder voices urgently.
Yes, urgent is definitely the key.
Mhm.
We have so many great questions in the chat, and we're going to start getting to them. I know that it's getting close to 8 o'clock or 8 o'clock Central Time, 9 o'clock Eastern Time. And but the panelists have all agreed to stay on a little bit longer if you guys are interested, and we're just going to answer questions until we're allowed to do that. We did put together a resource document for you guys. It'll be on the Doctors for America website, and also if you registered, it'll come to you in your email. We each put in there a little something that we thought you might benefit from, and also really kind of a place to start. If you're interested in joining this committee, you definitely, I think Keisha's going to put the email in the chat, and you can join us as well. You don't necessarily have to be a physician or a medical student. There are also what we call healthcare advocates who basically are doing the work alongside us. So that's something to consider. I'll go ahead and start with the first question, answering one of the questions, and then we'll jump around kind of and try to see what we can go through. There's a question in the chat by Judy that says, I'm a pediatrician and a strong believer in this cause. Here's my question. How do the physicians on this panel and on this webinar feel about showing graphic ER photos of victims being treated? This is related to all the forceful comments that appear on Twitter after the Stay in Your Lane fiasco. So many ER docs wrote about how they wish the NRA and Second Amendment backers could see the true effects of gun violence unfiltered. Obviously, there are privacy issues, and as an ER physician who also responded during that time with my own take on that, I fully 100% agree that if we were allowed to show these pictures to the full extent, we would be able to truly show the magnitude of what we see. I know that just on a conference that we had this weekend, I showed a picture of just the aftermath of the trauma room after we had worked on a trauma patient, and even that itself is very powerful because you see all the blood everywhere, and you see the aftermath of what we treat with and also what people don't see is the faces of the people who treat patients. I mean, it is a very emotional, stressful time, and I fully agree that having access to those pictures and to be able to put them out there would be very, very powerful, except HIPAA and patient protection confidentiality doesn't allow us to do that. And it's very hard to get permission from that type of a patient at that time, because obviously it's a very traumatic time for them. So yes, I agree. It would be very powerful to do, but I think it's very difficult to do that too. Sarah, do you have something to say about that too?
Yes, I would just like to extend Hala's answer beyond the legal ramifications of HIPAA. Like I said, I've worked at all 3 levels of government, local, state, and federal, lobbying for policy change. And almost all of that advocacy work and lobbying was done alongside survivor advocates. I myself am not a survivor advocate, but this question gets asked a lot. Michael Moore, the filmmaker who made Bowling for Columbine, a few years later, of course, we experienced the Sandy Hook tragedy, and he was quoted not long after as saying, someday someone is going to release photos of those babies killed at Newtown and everything's going to change overnight. And I, like you, am one of the people who always wondered, yeah, why don't we just show those photos? I really think Michael Moore is right. And I've learned 2 things in the 7 years since. Number one, unfortunately, not that many people care about other people's children. I wish they did, but they don't. The connection you have to make for people in their minds is you have to meet them where they're at, and you have to make them understand without putting it into words that that could be their child one day. And it's not that people are bad, it's just that's human nature, right? Most people are just not going to act in order to protect other people's children, but they will very much act in order to protect their own. And the second thing that I learned is that in this advocacy movement, when we work for policy change at the state and federal level, nothing would ever happen without the survivor advocates. They are always at the lead in our advocacy, and they always must be at the lead. And when I have asked some of the survivor advocates that I've worked most closely with over the years, that very question, how would you feel if it could change everything overnight? How would you feel about releasing the photos of your child? And almost to a person, they answer in the same way. They say, I would do it, but I'm not going to do that to my other children. I'm not going to do that to my mom or my dad or my husband or my wife. So it's just something that we have to allow the survivors to make a choice about. Much like the African-American woman whose son was brutally beaten in the 1960s, and only because I'm 51 and I've been on meetings all day long, I'm forgetting his name right now. Can anyone
Emmett
remind
Till.
me? Thank
Emmett
you,
Till.
Emmett Till. Thank you, Emmett Till. That was that mother's decision. And so it's a highly individual decision, and it would have to be made by the parent or the sibling, and it's just, I do think it would change a lot, but you know, the survivors, their needs have to come first, and it's their choice and must always be their choice.
Yeah, that is a really good point too, Sarah. Lisa, why don't you go ahead and try to tackle some of those ERPO questions that are in the chat? There's a few of them. Maybe we can put them together.
Great. Yes. So I know we're close on time, but there were several questions in the chat about extremist protection orders.
And we can kind of go a little bit more too. If people are wanting to leave, that's perfectly fine, but we'll stay as long as you guys want us to. Well, as long as we're allowed to.
So to summarize the couple questions, there's folks asking about what states allow physicians to petition for extremist protection orders. For those who don't know, extremist protection orders are civil court orders that temporarily remove firearms from someone before they've done something. So it's a preventative public health measure, and one of the policies that we developed at Johns Hopkins and have helped to implement around the country in 19 states and DC that have it. To answer one of the questions, now 5 states actually allow healthcare providers to petition for extremist protection orders. So if you live in DC, and I know my mom, who's a pediatrician, is on this call and she's in DC, so this applies to you, Mom. Maryland, Hawaii, New York, and Connecticut. New York and Connecticut just allowed access to healthcare providers last year. Those are all states in which a healthcare provider can petition for an extremist protection order for a patient they believe is at risk of harm, either towards self in the form of suicide or interpersonal violence. I will say that when we have advocated for either including these provisions for healthcare providers in extreme risk protection orders or expanding existing laws to allow healthcare providers to petition, we have been very cognizant of the concerns about liability and privacy that some physicians have discussed. And we actually have a whole set of recommendations from Johns Hopkins specifically about healthcare providers as petitioners. But I will say that this is a promising tool. Extreme risk protection orders are a promising tool, and giving healthcare providers the option to petition is also very promising. This doesn't mean that if a healthcare provider doesn't petition and their patient does go on to do something that they should be held liable. That's not the case for allowing healthcare providers to access this tool. It's simply another group of people that may be in close contact, specifically when we're talking about psychiatrists, someone who might be at risk of harm. And if anyone's interested in all things extreme risk protection orders, please reach out to me. That's a huge part of my job.
Thank you, Lisa. That was really informative. Lauren, do you want to go ahead and there's a couple questions in there that have your name on them?
Yeah, absolutely. I saw one in there specifically from someone who is in Michigan asking about whether the Michigan State University shooting that happened last week was going to accelerate plans for gun bills. And the answer is yes. Michigan is recently, I think just in the last few days, they proposed legislation that has universal background checks in it. It has red flag laws in it. There are safe gun storage provisions in it. They didn't introduce an assault weapons ban. That may just be a little bit too far of a bridge to cross at this point. But the three things that I just mentioned are huge, right? I mean, they really are. They're huge. And I know that Moms Demand Action is all over this right now. They had hundreds of people at the state capitol. And I know March for Our Lives and lots of organizations are on this in Michigan. So it's encouraging. I think there's, as I said before, Michigan has a Democratic trifecta with the governor willing to sign this legislation or some legislation into law. So we'll just see how that plays out. And then there was another question, which is a really good one, about if you have an assault weapons ban in your state, what is to stop a perpetrator from buying it in the state across your border and bringing it into your state? And the answer is we don't have borders at our state. So in the PICA law, Protect Illinois Communities Act, there is a provision that gives funding, and there will be a task force through the Illinois State Police to coordinate when they seize weapons. There will be huge penalties associated with across state trafficking of firearms, but it's porous. We live in a porous country with no borders. So really what we need to be doing is passing these laws at the federal level, or passing them, in bigger blocks. I mean, Illinois is in a really bad place. In particular, we have bad gun laws all around us. And people frequently talk about how gun violence is so bad in our states, but truly more than half of the guns that are involved in crimes originate from different states with poor gun laws. So it's a great question, and it's an uphill battle.
Sarah, you wanted to add to that?
Yeah, I just want to follow up and say everything Lauren said is exactly right. I just want to build on a little bit. I'd like everybody to stop and just think for a few minutes. If Democrats had just only about 5 or 6 more Democrats had been elected to the U.S. House of Representatives in November, we would have seen a federal assault weapons ban signed into law. So in addition to everything that Lauren said, please keep in mind as well, all of these gun laws are only as good as what impact they have on the communities and the states around them. And until we have federal level gun laws, we're only going to be safe to a limited degree. So if you're really serious about seeing real change in this country, it's not enough to just advocate at the state level. It's not enough to just advocate at the federal level. You have to make sure people who will vote in favor of common sense gun safety legislation are in the majority to both houses of Congress. So we can get that done, but we need to start by asking everybody who runs for Congress or for the Senate what their stand is on common sense gun safety legislation. And if they're not in favor of it, don't vote for them.
Yeah, that's a really good point and a really important one too. It is a couple minutes past 8, so we won't be offended if you guys choose to leave, but we also have so many other questions that we want to jump in and answer. So we are going to just keep going. Just know that there's a few more links in the chat that just tells you that if you are a subscribed DFA member, you can get CME for this. You just have to fill out the survey for it, and we'll continue on. Elliot, do you want to answer a couple of the questions that we were looking at?
Great, thank you. I'll go from shortest answers to longest answers. First, just to circle back quickly to Judy, the photos, these are actually things that we bring as testimony into Senate level meetings. So these photos are being addressed. They're just not being addressed with the public, but they are being shown to staffers, many of whom are upset, obviously, by those images, but I think that that's an important thing that they need to understand as the federal legislature. To Howard, which is the second from the top in the Q&A. This is a great question too. Unfortunately, it's very difficult to regulate what a physician says in a patient room. This is done on a practice to practice basis in some pediatric offices for sure. And there are many that ask these questions, but there's no way to regulate it in a sense that it would be a requirement. Maura Hirschauer, who is an Illinois House of Representatives member from the southwest suburbs of Chicago, she actually has a bill to require pediatricians to inquire about safe storage with firearms in the home, but it hasn't received much traction due to other more important issues. Did you want to chime in there, Lauren?
Yeah, no, I was just going to add in there, there's through Moms Demand Action, there's a Be Smart program that we actually are piloting in a bunch of pediatricians' practices. So it's a program through Moms Demand Action. It's like a sister program that models like how you have conversations about safe gun storage. If, for example, you're sending your kid on a play date, and to ask if there are firearms in the other person's home. So for example, having a brochure from Be Smart or having a Be Smart trained person go in and give presentations to pediatricians' offices, to all of the pediatricians in the practice, it's actually been really effective. So, that might be something that you would want to reach out if you have a practice and have that training come in, because those conversations aren't really normal for everybody to have, and they're uncomfortable, and just like getting practice in how to do them is helpful.
Yeah, and it's actually surprising, just to add to that also, even from an ER doc, it's surprising when patients come in and they're in there for all kinds of things. We have such a forum to be able to ask them questions about, obviously we do a lot of asking of like, are you feeling like you're going to harm yourself? And to have the ability to ask them, do you have something? It's actually in 2023, it's a requirement now that we address the social determinants of health in the emergency department, which everyone's still trying to figure out how to do, but it's going to be really important moving forward. And sorry, Elliot, jump back in.
That's okay. And Cassandra, I think that your question actually really is fantastic, because the mental health scapegoat, as some of the naysayers to regulation, that issue is pervasive, as you know. And I think the best way to understand how to detract from that argument is really to address the best data that's available for mass shootings. If you look at the largest mass shooting profile, the largest database that was ever created, it was actually created by a couple PhDs in Minnesota, and they profiled a lot of it in this book called The Violence Project. I would highly recommend it. And what they did was they analyzed over 200 data points of different mass shooters, really to figure out what makes the mass shooter. And there were really 5 things that they came down to that sort of resounded amongst all of these mass shooters. And the first was a personal history of trauma. And that can be many things. That can be being bullied, exposure to gun violence, even just if you live in an unsafe neighborhood where gun violence is very prevalent, or an exposure to abuse within your home. The second thing that they found was that almost all of the shooters were in crisis within usually 45 days. They lost a job, they broke up with a spouse, or a parent died. And 3, 4, and 5 are very hard to control. Number 3 is that they're all following a narrative, a story that's online. They're trying to emulate another mass shooter. The fourth one is they have someone to blame, which is based in hate. And the fifth one is that they have access to a weapon. So what you don't see amongst all of these qualities is you don't see a resounding history of depression. You don't see a resounding history of paranoia, schizophrenia, bipolar disorder. So when people use that mental health discussion, they're really not using it based in evidence. And it's a difficult thing to counterpoint, but that's why we bring physicians to this table. So thank you for asking that question.
Great.
I would just add one thing to that really quickly, that there's only one element in those 5 things that we can control, and that's access to the weapon.
Yeah, that's for
And
sure.
the prevention of trauma by preventing more of these episodes.
Sure, that as well. They're connected.
And since
Sarah?
Lauren made the point about how the only thing we can really control is access to the weapon, I'd like everybody to just take that as a jumping off point to take it one step further. Think about it. All of the ways that the gun lobby tries to block the changes that we want to make, the way they try to block the passage of laws that will require safe storage, that will crack down on straw purchasers, which will have a direct impact on reducing the flow of illegally trafficked firearms. They're all about making sure everybody who wants access to a gun gets it. The gun lobby wants everybody to have access to a gun, even criminals, because when gun violence is high, they sell more guns everywhere. So that is what we're up against. We are about blocking access to guns by people who shouldn't have them. We're not about taking away people's Second Amendment rights. We're about preventing children, people who are not in an emotional state where they should be carrying a gun, preventing people who intend to use that gun to commit a crime. That's what we're about, blocking access. They don't want us to be able to block access. Our enemy is not gun owners, because the vast majority of responsible gun owners agree with us. The people who are not qualified to have guns should not have them. Our opposition is the gun lobby, and that's what we need to stay laser focused on.
Yeah, that is absolutely true. Sarah, there was another one I think you wanted to jump in on. I think Ashby had some comments that you were going to comment on.
Right, I'm so glad Ashby raised the issue of the effect on children of active shooter drills. Ashby, I know I can remember so clearly, sometime within the last 12 to 18 months, I read a peer-reviewed, intense academic article on the negative effect of active shooter drills on school children. I was looking for it for the last 15 minutes while everyone else was talking. I wasn't able to track it down, but Lisa Geller is the research whisperer, the academic journal paper guru. So Rachel, or Lisa, excuse me, if you can help us locate a research article on that, I'd really appreciate it. Or you know, Ashby, reach out to me and I'll keep looking and we'll find it. But there really is no doubt that active shooter drills do 2 things. They have a negative impact on the psyche of children, and they also give a roadmap, a plan to would-be shooters about how they could go about committing that type of atrocity. So there are serious problems with active shooter drills. And I'm also really grateful to Ashby for asking the questions. I forget exactly how she worded it. What can parents do to force districts into disclosing the types of drills and when they occur? You need to talk to your school boards, and you need to really bring this issue up and tell them you want it addressed, and you would like to know answers. And a very specific question that you want to know the answer to is, who is providing the active shooter drills to your child's school, and who is profiting from those active shooter drills? The answer may be no one. It may be a company that is nonprofit, and that's what you want to hear, right? And then the next step, you want to know what that active shooter drill entails, and kind of do your research and find out whether it's minimizing the impact. We know for sure that and Lisa, jump in here if you think I say something incorrect on this issue. But I'm pretty sure researchers can have pinned or have a lot of certainty about the fact that if the children are not aware that the drill is a simulation, then that is incredibly harmful for children. So at the very least, your school's active shooter drill program should always be a simulation. It should always be made very clear to children that this is not real. It's just a test, and they must have advance notice. And then finally, the other thing that you just need to be aware of, this is $1 billion industry now. I mean, I don't know the exact number, but there are many companies that are providing schools with these types of active shooter drills. And just like you would sort of investigate something that you learn on the internet or in media, you would kind of consider what is the source? Where is this article that I'm reading coming from? You want to do the same thing when it comes to the company that's providing active shooter training for your school. Who is funding them? Who put up the money to help them get started? Because in many cases, it's probably going to be a gun industry organization, a gun lobbying organization. And one in particular that we know backs some active shooter drill providers is the National Shooting Sports Foundation. Many people have heard of this organization, but most people are not aware that it is much farther to the right on the issue of gun violence prevention than the NRA. They've spent many millions of dollars more than the NRA over the last several decades to defeat legislation at all levels of government that would make us safer from gun violence. So that is really a key term. You do not want your school you don't want your active shooter providers, training providers funded by the National Shooting Sports Foundation or any other member of the gun lobby.
Yeah, so I am writing a paper on mass shootings for a special edition of a journal that should be coming out in the next couple of weeks, although I've been writing this for 2 years, so it could also be coming out in 2 years. I have no idea. But my co-author is a big proponent of lockdown drills because she administers them herself in New York State where she lives. So I do agree with Sarah about the provider essentially of lockdown drills is important. I would agree that the National Shooting Sports Foundation, obviously the NRA, all those affiliates, they have a different goal than we do in safety and protecting children. But I will say the evidence is mixed on that. There are some studies that I've seen from my co-author. Her name is Dr. Schildt. She has done some studies showing that they are beneficial. And that they've reduced the number of fatalities in the schools where they've administered if there was a shooting there. Obviously, we're talking about really small numbers here. But I will say in this paper that we're focused on ways to prevent mass shootings to begin with, but then also to minimize risk if they do happen. So lockdown drills and also banning large capacity magazines because those are associated with more fatalities and also more mass shooting incidences. So I will send that to Hala and to Keisha, the DFA team, when that paper does come out, because I hope it'll be interesting.
That's perfect. And we'll definitely disseminate it. There were just a couple other things I just want to answer. And then I know that we're hitting that 8:15 mark and probably need to wrap up. Like you, Lisa, I do have a mom who's a pediatrician, and I see that she's also answered something or asked something in the chat. The question of checking kids in entering schools, is it doable and helpful? And I feel like that's a really great question, and the data is just not great on it. We've, in the same way that we've looked at these drills, we have much better data on that, but some of these things are definitely doable and definitely would be helpful, but financially a lot of places just can't do it. And so I know that's one of the reasons why a lot of places don't spend their resources doing that. If you have to look at what you would spend your resources on, would it be more important to bring in educators and talk to parents about safe storage versus putting something so that you're checking every kid as they enter the school? I think there's probably debate on that. Yeah, what's up, Lauren?
I was just going to add one thing to that. There are a lot of programs across the country for kids to self-report issues that they hear about within their school system. And I would just encourage all of you to ask your kids Tell your patients to ask their kids, like, what is the protocol within your school? How would you go about reporting if you thought you had a friend who was exhibiting signs of risk, either to themselves or to others? There's a lot of confusion in the way these programs are presented to kids. And just to clarify that for them, sometimes they're presented as helplines for the kid, when in fact they're really multi-purpose, and they're set up so that kids can talk about other people in reporting. So it's just another line of defense in schools that gives a little bit more of the power to kids, to students.
I think there's one more that we just popped up that we hadn't discussed, but it's something that's near and dear to me, the Stop the Bleed programs. I am a Stop the Bleed instructor. I do it to a lot of different schools. I've taught Stop the Bleed, which for those who don't know is something that was put out by the trauma surgeons and was a big grant that was awarded to every school, got a certain amount of tourniquets that they were allowed to put in their schools. And for schools like a lot of the inner city schools, it is something that is good to have, and the teachers should know how to do. I think it's not necessarily that the students need to, but I think teachers, part of their training. I've taught a lot of different nurses and teachers basically how to do it, just because it's not just about also if someone gets shot, it's anything, you know. Anything that bleeds that much that can be stopped by a tourniquet is a life-saving measure. And we see it all the time coming in the EDs when people come in with a tourniquet in place. So I do think it's a very effective and powerful program. And the data shows that it really does help having people at that level learning how to do it. So I do believe schools should do more of it. They all have this grant to be able to have these tourniquets in them. So I think with that, we can conclude our discussion. This has been amazing. I'm so grateful to all of you guys for taking the time tonight to not only be here as panelists, but for all of you to spend your evening with us. And I know your time is so valuable, and really, really appreciate that you're spending this evening with us. So you'll be able to get a copy of this recording and a link to the recording, and also the resources that we've talked about. And you'll have plenty of homework to do, and you can join at any level that you want, and we'll be able to help you. Hopefully our contact information is on those sheets as well, and we're all accessible. And so please reach out to us if you have any questions about anything. I know I'm speaking on behalf of all the panelists here, but I know that they would be okay with you reaching out to them as well. So thank you once again. A reminder, 1 CME credit for this if you are a DFA member, don't forget. And I think with that, thank you for attending, and have a great rest of your evening.